Hi, my name is Lexi Bomberger, and today I'm going to be talking about how Japan has been widely successful in reducing infant mortality rates and disparities across the country, and how the US and India can learn from it. So to begin, the infant mortality refers to the death of an infant before his or her first birthday, and the infant mortality rate is calculated using the number of infant deaths for every 1,000 live births. Japan is among the top 3 countries for lowest rates of infant mortality, which this year reached a low of 1.6 deaths per every 1,000 live births. In comparison, the United States has about 5.6 deaths, and India has about 27.6 for every 1,000 live births. So you might be asking, what's Japan doing to keep rates of infant mortality so low, and how does this affect disparities? The answer lies in the healthcare system, which provides universal healthcare coverage to its citizens. And one thing this country does really well is placing an emphasis on primary and preventative healthcare. It also allows citizens access to cheap healthcare. In fact, it's so cheap that the average citizen visits a healthcare facility 14 times a year. Well, a lot goes into making the healthcare system so affordable. One of the leading contributors is the fact that the federal government places caps on drug and procedure prices. And these are negotiated every 2 years to keep up with the economy and keep healthcare affordable. The US and the Indian healthcare systems are a bit different. The Indian healthcare system is similar in that it provides universal healthcare coverage, but due to poor funding, poor infrastructure, and high out-of-pocket costs, only about 37% of citizens in India have some form of healthcare coverage. And only about 1/5 of healthcare is financed publicly. The US, on the other hand, does not provide universal healthcare coverage, but is rather a mix of private and public insurers, and it's a market-based system that's consumer-driven. So unlike Japan, the federal government does not place caps on the price of procedures and drugs, and this promotes competition between different healthcare institutions and drives high healthcare costs. Of the three, as mentioned before, Japan has been very effective in reducing disparities in rates of infant mortality. And this has been done by prioritizing education, affordable healthcare, and primary and preventative care. So in the United States, more than 46.7% of people live in poverty. And this is due to the fact that the United States has some of the largest wealth gaps in the industrialized world. A lot of disparities in infant mortality exist based on education and socioeconomic status. Studies have shown that an infant born to a mother who never received a high school degree in some states is more than twice as likely to die compared to an infant who was born to a mother with 4 years of college or more. And this is because education and income influence a lot of maternal health behaviors. They influence environment, maternal health, social networks, and more. So for example, an infant born to a mother of low socioeconomic status may not receive as much health care due to affordability and accessibility issues compared to a child born to a high income family. A possible solution for addressing these disparities occurred under the Obama administration. The proposed expansion of Medicaid held the potential to increase the coverage for adults with incomes up to 138% of the federal poverty level. However, the Supreme Court ruled against making the Medicaid expansion required, but rather it's optional. I'm going to share my screen real quick. Here you can see 39 out of 50 states have adopted the Medicaid expansion. And the remaining are a lot of states in the South, which typically tend to be poorer. Here you can see states based on their income. And Mississippi is actually the poorest state in the United States. And it also ranks 49 out of 50 for education. And it has not expanded Medicaid. So here we can see this is an issue because it's going to continue to perpetuate disparities if mothers in these low income areas don't have as much access to healthcare. So Japan has kind of taken on educating pregnant women itself. The universal use of what is called the Boshi Kenny Techo, or the maternal record book, has improved health literacy and education for mothers across the country. And it has made disparities based on education very minimal. The comprehensive handbook is basically advice for mother to child care, and it places a large emphasis on preventative services and encourages mothers to seek prenatal care very early. And it's been a driving factor behind the high literacy rates across the country and regular physician visits among pregnant women in Japan. The United States should implement something similar, as only about 5 to 7% of healthcare costs are on primary care compared to the developed country average, which is about 14%. The United States should follow in Japan's footsteps and allocate a greater percentage of healthcare to maternal education, as well as work to expand coverage and make healthcare cheaper for individuals of low socioeconomic status, especially for states who have not received the Medicaid expansion. So India also faces disparities, but this is solely based on geographic location. India has worked to address these disparities through the implementation of the Reproductive and Child Health Program, which basically focused on immunizations, maternal health, family planning, and barriers to accessing healthcare due to poor infrastructure and lack of doctors, physicians, etc. There's also another policy implemented under this program, which provided free transportation and free deliveries to pregnant women of low socioeconomic status. And it actually increased the number of births supervised by professionals from 43 to 83% from 2005 to today. Still, there are high disparities in infant mortality based on location. I'm going to share my screen again. Here you can see that Kerala, a state within India, has an infant mortality rate of less than 10. It's here in the green at the bottom. Whereas other regions such as Uttar Pradesh and Bihar have mortality rates near 50. And this is, again, attributed to the inaccessibility to healthcare in rural settings and lack of facilities at primary health centers. As mentioned before, such as doctors, beds, transportations, these barriers still exist despite India's efforts. And Japan also had issues with disparities in based on geographic location. And what they did was provide a network of community volunteers and public health officials who assisted pregnant women with enrolling in prenatal care and encouraged early action. Other groups included neighborhood housewives and community leaders who assisted their community with health education. This has been widely effective in promoting health literacy and reducing infant mortality rates across the country. A similar program would be effective in India, especially in rural settings. While it's easy to say India should build more hospitals, have more infrastructure, greater access to healthcare. It's difficult with the state of the economy, but a cultural shift, such as utilizing community members and strengthening education, could be very beneficial in decreasing rates of infant mortality. So as we can see, both the United States and India can benefit from Japan's framework.